Welcome and thank you for joining us today, live or on the recording, for episode 19 of Dr. Jeff Talks About Sex and Intimacy. Prostate health means so much to me that you took time out of your busy day to be with us, and we really appreciate that. So welcome. We are on social media, so we're out there on Facebook, on YouTube, on X, on all these social media sites. If you're a Facebook person, please follow us, because when we have 100 followers, we will be able to stream live there rather than just the recorded version. So please follow us on Facebook. Oh, if you haven't gone to the website to learn more about all the upcoming visits, pull up the calendar and see what's coming up. Look at all the old episodes. We have phenomenal speakers and guests that have done some really wonderful episodes, and you can find out all of that on the website. So please go there to find us. Hey, you can listen to us in your car or wherever you are with your favorite music streaming service like Spotify, Amazon Music, iHeartRadio. So don't forget, when you're cruising along, you can be listening to the audio for us. If you want the video, go to YouTube and Facebook and places like that, or the website. All right, so I just want to remind you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, you are welcome. And we are so glad you are here with us. So the goal of the podcast is simple. The goal of the podcast is to empower and enlighten you with evidence-based scientific information to improve your sexual health and to deepen your loving relationship, helping you live and love more fully. Speaking of love, this past Sunday, we celebrated Mother's Day, a time to honor one of the most profound sources of love in our lives. I was blessed to have the best mother in the world. Though she's been gone for almost a decade now, I still miss her every single day. Her love was unwavering, unconditional, and filled with a sense of belonging that shaped who I am. My wife is also a wonderful mother to our sons. I'm so thankful for the mothers in the world. My hope and prayer for you is that you've experienced the kind of brilliant, all-encompassing love, whether from a mother figure, or someone who has made you feel truly cherished. We all need that kind of love. And so I honor all the mothers and caregivers who give so freely of themselves and so selflessly. Today's episode, we are diving into a crucial topic for men's health, prostate health. The prostate is this small gland with a big impact, playing an essential role in urinary and sexual function. Yet prostate issues are common and can significantly impact quality of life. Today, I'm joined by Dr. Alex Glaser, a board-certified urologist and a clinical associate professor at the University of Chicago. He specializes in treating men with lower urinary tract symptoms, LUTS, and benign prostatic hyperplasia, BPH. Dr. Glaser is the Vice Chief of Urology at Endeavor Healthcare, formerly called North Shore Healthcare. He also has expertise in aquablation for BPH. And last fall, he also published a chapter in the book that I wrote, Core Curriculum for Urologic Nurses and Associates, second edition. And so he helped me greatly by writing an awesome chapter for that book. And I welcome Alex Glaser. We are so glad you're here with us. Thank you so much for taking time out of your busy schedule in clinic and in the OR and everything at Endeavor. And welcome. Thank you.
Yeah, thanks, Jeff. Thanks for having me on. It's good to see you again, and happy to be here.
Excellent. Well, let's jump into your presentation.
All right. Well, again, thanks for having me on the pod. And today we're going to talk about prostate health. In general, prostate health is a critical aspect of men's health. And it's often overlooked or misunderstood. So in this talk, I want to explore the anatomy, the function of the prostate, the importance of maintaining prostate health, and some key screening and management things that we can do throughout a man's life. So, things we're going to cover today. I'm going to talk about what the prostate is, where it is, the importance of prostate health, and then some common conditions, that are found in the prostate, such as prostatitis or inflammation of the prostate, benign prostate hyperplasia. We often call it BPH, which basically means an enlarged prostate gland. And we'll also, touch on prostate cancer a little bit, although stay tuned because next week in the podcast, one of my other partners, Dr. Helfand, will be here to talk in prostate cancer in a lot of detail as well. And finally, what you can do to maintain prostate health and lower urinary tract health kind of throughout your life. And I'll try to hit a few myths or common misunderstandings throughout the talk. So understanding the prostate, the prostate, it's a small gland located kind of below the bladder and anterior to the rectum. And you can kind of think of it like a donut that sits around the urethra. And, essentially, the bladder stores urine until it's time to pee. And then when it's time to pee, the bladder squeezes and that pushes urine through the middle of the prostate and then out through the urethra and out to the outside world. And the prostate is also important for sexual health. So the prostate also creates a lot of the seminal fluid. So that when there's an orgasm or ejaculation, about 25% of the fluid comes from the prostate itself. And the prostate sort of acts like a valve. So you either pee or ejaculate, but not both at the same time. The overall function of the prostate, again, is to produce some seminal fluid. And that is important because it nourishes and also transports the sperm. And therefore is, very important for both urinary and sexual function. Some brief slides about the anatomy of the prostate. So the prostate can really be split into a couple different zones. There's the peripheral zone of the prostate, and that's where most prostate cancer forms. It's kind of on the outside shell of the prostate. So when a surgeon or doctor does a digital rectal exam, DRE as we sometimes call it, or rectal exam, what we're doing is we're feeling the back edge of the prostate, the peripheral zone, to feel for nodules that might be concerning for prostate cancer. There's also the central zone of the prostate that essentially surrounds the ejaculatory ducts. And then the transition zone is one of the other important zones of the prostate. And that's the zone that really grows with age and with benign prostate hyperplasia. So as that prostate gets bigger and bigger, it's primarily the transition zone that's doing. And then finally, there's the anterior fibromuscular stroma, which is kind of on the top of the prostate, if you think of it that way. And importantly, we're now finding more prostate cancers in the anterior fibromuscular stroma, especially with the advent of MRIs for prostate cancer. But it's also important for kind of connecting the prostate to the rest of the pelvic floor musculature. Next, we'll talk about some prostate health. In general, maintaining prostate health is vital for men's overall health and well-being. And issues with the prostate can lead to various health complications. Abnormal prostate health can significantly impact men's quality of life, including urinary function and, of course, sexual health. And addressing these issues can improve overall well-being and quality of life. So it's important to keep these in mind. As I mentioned before, there's a couple common prostate-related issues. Prostatitis is an inflammation of the prostate gland. This can lead to a lot of pain and discomfort. And there's importantly a couple different types of prostatitis, and it's a condition that's often misunderstood. And we'll touch on that in a little more detail. Benign prostatic hyperplasia, or BPH, is the technical term for an enlarged prostate gland. And this is the most common condition that urologists see in the clinic. And it basically means that prostate gets enlarged so that when that bladder pushes to push the urine out, there's more obstruction or blockage because the prostate has gotten larger in size. And then finally, prostate cancer. 1 in 8 men will experience prostate cancer throughout their lifetimes. And it's an important condition that, certainly can be life-threatening. So early detection through exams, blood work is critical for effective treatment. Next, we'll talk about prostatitis. So prostatitis is that technically means inflammation of the prostate gland. There's a lot of different types of inflammation, and inflammation can sometimes get a bad rap. There's inflammation that's good for things like fighting infection, fighting cancer, but then that inflammatory signal should also be turned off. And when that inflammatory signal isn't turned off, that can cause a lot of symptoms like pain or discomfort. However, it's important to know that not all pelvic pain or discomfort is really related to the prostate. One myth is that, pelvic pain, I've got prostatitis. And this is sometimes analogous to why we call, uterus removal in females a hysterectomy, and the prostate can get blamed for a lot of things when it's actually some other conditions, things like pelvic floor dysfunction. The pelvic floor is really part of our core, just like our back. And so just like you can have back pain that's from the back muscles, sometimes pelvic pain comes from those pelvic floor muscles, and things like physical therapy can actually be the best thing for you as well. That being said, some of the symptoms of prostatitis, can be quite impactful in terms of quality of life. You can get painful urination, pelvic pain, and in some of the, true infectious prostatitis signs, you can get, other systemic symptoms, kind of like having the flu. But there's also what we call chronic prostatitis, which is also associated with things like anxiety, can also be associated with significant stress. And all of these things can impact sexual function, intimacy, as well as urinary symptoms. So as I mentioned, there's four general types of what we call prostatitis. There's acute bacterial prostatitis, and this really means got a bad urine infection. Okay, so urine infections are common. They're less common in males. Only about 12% of men will get a urinary tract infection. But if that urinary infection gets into the prostate, you can have really, an extremely tender prostate. You can have very severe infectious symptoms, sometimes even abscesses in the prostate. So if you're having fever and other things associated with urinary tract infection, definitely need to be seen by a healthcare provider. There's also what we call chronic bacterial prostatitis, and this is a little bit more tricky to diagnose. Sometimes we get specific fluid from the prostate to examine for bacteria, and are sometimes treated with long courses of antibiotics. And then we move to what we call chronic prostatitis or chronic pelvic pain syndrome. And this is a really tricky condition because, sometimes it has to do with infection or inflammation, and sometimes it also has to do with other things that cause a lot of pelvic discomfort. And that's why it gets thrown into this bucket of what we call CPCPPS. And treatment and diagnosis of this can be certainly challenging. But if we're having a lot of chronic pelvic discomfort and things aren't getting better, certainly important to be seen by a urologist or your doctor to make some diagnoses. And then finally, we often see inflammatory prostatitis, which is sometimes asymptomatic. And we find this with, inflammatory infiltrates in the prostate, either on histologic examination of the prostate, i.e. taking biopsies or pieces of the prostate, or even on things like MRIs. We often see inflammation in the prostate, especially in that peripheral zone of the prostate, and that can drive other things to go awry, like the PSA level, which is a screening tool for prostate cancer. So jumping into some of the science a little bit, we have shown that chronic inflammation in the prostate is associated with worse urinary symptoms and larger prostates. And this has been shown now in a couple of very large, well-designed studies. And if we look at inflammation, it is associated with higher risk of having bad urinary symptoms, having a larger prostate, as well as what we call progression in BPH, getting to the point that you need surgery or a catheter or something that's really bothersome. So, this led our group to evaluate what kind of inflammation this is that's driving this. In general, things like anti-inflammatories like steroids or ibuprofen, what we call NSAIDs, really don't work for this. So what we did is by leveraging large-scale electronic medical health record data, as well as looking at mouse models in the basic science lab, and then doing single-cell RNA sequencing from my patients with large prostates, we showed that there's a particular pathway called TNF that can drive a lot of this prostate inflammation. And so one ongoing question is, can we target that inflammation? Can we improve it? And so this led to an NIH-funded clinical trial where we're examining whether we can evaluate or alter this inflammation inside the prostate. And in general, there are three main aims of this one study. We're looking at a small randomized controlled trial of about 70 patients with a large prostate and symptoms from that large prostate. And what we're doing is either giving them this drug called adalimumab or a placebo and seeing what happens. And we're also doing some other things by looking at that tissue under the microscope, doing some fancy stuff like single-cell RNA sequencing, and then looking at genetic variants and how those might impact treatment or outcomes. So in general, this is a very exciting study. We presented it recently at the annual urology meeting, but I want to share it with you guys as well. What we're doing is taking men, as I mentioned, with large prostates and some urinary symptoms, and then randomizing you to either get this drug called adalimumab, which has been used for many years in conditions like rheumatoid arthritis and Crohn's disease, and either giving that or a placebo every 2 weeks for 6 injections. And then we're getting an MRI of the prostate before and after, looking at various questionnaires that evaluate urinary health. And then at the end of the study, getting some tissue of the prostate to look at it under the microscope and do some more of that basic science work. So we're very excited about this study. If you or someone you know is interested, please reach out to us. We'll have the links to some more information about the trial, as well as our general research study in the chat and the description on the YouTube channel as well. So next, I want to move to a discussion of enlarged prostate. Benign prostatic hyperplasia, or BPH, is characterized by an enlarged prostate gland. And factors contributing to BPH include aging, different hormonal changes throughout life, inflammation, and genetics. BPH is the #1 reason why men visit the urologist. The prevalence increases with age, and nearly everyone who has it eventually says it impacts their quality of life. This is Medicare data. So if we look at Medicare data, the prevalence of BPH, or the probability of having it, increases with age until about 30% of men who have Medicare have BPH. So if you think about all the men you know who might be 65 or older, about a third of them probably have bothersome BPH that's leading them to seek some sort of treatment. This also means that that leads to about 2 to 4 office visits per year for the urologist. So if you think about the burden of this disease, it's driving a lot of men to seek treatment and a lot of men to come and utilize their healthcare resources, seeing their doctor. And then next, as I think a lot of us know, the global population is getting older, and that's because we're doing a better job keeping people alive, making sure everyone has resources. And as the population ages, the burden of BPH is also going to increase. By 2050, about 17% of the population will be over age 65. And then, therefore, the years lived with a large prostate is going to be 3 times higher than any of the urologic cancers or other conditions that we treat. So, in short, having a large prostate is going to be one of the most important things that urologists treat. When does the prostate start to grow? Well, this is an old study, but it's from some famous urologists at Johns Hopkins, Don Coffey and Pat Walsh. And they looked at autopsy studies and essentially showed that around age 50 or 60 is when the prostate starts to grow. And then after that starts, the prostate can continue to grow, leading to that obstruction and those bothersome urinary symptoms. In a more modern series of a couple hundred men with MRIs of the prostate, obviously a better way to image the prostate, we show that the different zones of the prostate have different growth characteristics. The peripheral zone, where a lot of prostate cancer grows, generally peaks around age 50 or 60 and then pretty much stays the same. However, the transition zone of the prostate can continue to grow, and those men with a large prostate are more likely to see continued growth of their prostate over time. Well, does that mean that urinary symptoms are all due to the enlarged prostate? Actually, no. There's more to urinary symptoms than just prostate size, and it doesn't correlate with age perfectly either. So if we look at this modern art graphic, this is a graph showing on the x-axis prostate volume, and on the y-axis urinary symptoms as measured by one of our standard questionnaires. And there is no correlation. So there's guys out there that have a really big prostate and aren't that bothered, but there are guys with really small prostates that have very severe symptoms. So it's more than just evaluating how big your prostate is to determine what the best treatment option for you is. And there's a lot of things that can influence urinary symptoms. And some of those factors include things like inflammation, genetics we know play a role, but a lot of other things can influence urinary symptoms too, like sleep disorders, sleep apnea, diabetes, nerve problems, metabolic syndrome, and so of course, fluid intake, alcohol intake, caffeine intake can all play a role as well. So what are the symptoms? Well, the symptoms of BPH can include things like frequent urination, trouble getting started with your urinary stream, having to stand there at the urinal, and then having a weak urinary stream, starting and stopping while you're urinating. And then the things that your doctor will typically do, are things like a prostate exam. Sometimes we do a quick bladder ultrasound at the bedside to see how well you're emptying your bladder. There are things we can do where we can have you pee in a funnel to see how fast you pee. And then there are standard questionnaires that we give to kind of standardize how we measure a lot of these symptoms. And importantly, urinary symptoms are complex. And this slide is not really meant for you to dive into detail, but this is a way that we measured all the different types of domains of urinary symptoms. What bothers what? Do I have urgency of urination, hesitancy of urination, weak stream, pain? And if you look at all those different things, there are a ton of factors that we have to keep in mind as we measure how well we take care of men and how we're doing at improving their symptoms. The most common measurement tool that's used is this thing called the IPSS, or the International Prostate Symptom Score. Almost all urologists use it. So if you come seeing a urologist especially for urinary symptoms, he'll probably fill this out in the office. And what this does is it provides us a standard way of kind of measuring how severe your urinary symptoms are, and also how it's impacting your quality of life. Um, but we also created a newer questionnaire as part of the NIH that includes some questions that are definitely important to men. So similarly, this is a one-page, easy to fill out questionnaire, but it also includes a lot of things that are very important to men, like incontinence. So anytime guys leak urine, it bothers them. So at our practice in particular, we think it's very important to have a standardized way of measuring those things like incontinence. Um, in this graph, I'm showing urinary symptoms as measured by these two different questionnaires. And essentially, if you look up and to the right, you see more severe urinary symptoms. And almost all of these men with more severe urinary symptoms have some kind of urine leakage, showing how important it is to ask these men about these symptoms. So certainly if you're having those symptoms, make sure you bring those up with your doctor. Um, this is an analogous graph showing what we call quality of life or bother. Some guys have really severe symptoms, but I'm fine. Doesn't bother me that much. So it's really important to know how bothersome it is to you, and for you to express that to your doctor so that we can see how important that is in terms of treating it for you. Um, Another test your doctor might have you do is a urine flow test. And there's a couple ways of doing this. The easiest way is basically to have the urologist in the office. They have a funnel with a special measurement device, and we basically see how fast you pee. And that gives us how much urine you peed, how fast you peed, and then we can do a quick ultrasound to see how well you did. How well did you empty your bladder? And it's amazing how much information we can get from that test. There's a couple other ways of doing this as well. This device I'm showing here is called UroCuff, which is a way for us to measure also how hard your bladder pushes, how much push your bladder has in order to push that urine out. And that can tell us things like, are you obstructed or are you not blocked? For example, the graph on the right here, where there's an X in the green, that's showing a young man. His bladder doesn't have to push that hard, and he's got a really fast urine stream. In contrast, the graph on the left, there's an X in the red box. That's showing that bladder is pushing really hard, but urine flow pretty minimal. That guy probably has a big prostate or could use some sort of procedure from his urologist. So, what are the treatments for an enlarged prostate? Well, there's things like dietary and lifestyle changes, but there's also medications and in some cases surgery. So it's important to talk about these options with your doctor. This is kind of showing the spectrum of different treatment options for an enlarged prostate. Um, and I've listed them here kind of by invasiveness. There are things like medications. The most common medications we use are what are called alpha blockers, the most common being tamsulosin or Flomax is the brand name. And then there's also what we call 5-alpha reductase inhibitors. And these are meds like finasteride or dutasteride that can shrink the prostate over time. After medications, we have what we call minimally invasive surgical treatments, or MISS. And there are options there, including iTind, UroLift, Resume as the most common treatment options, although there's some other new things in the pipeline there as well that are very exciting. And then we move to kind of standard procedures. And these generally involve going completely to sleep in the operating room, where the urologist some way will kind of core out that middle of the prostate to create a bigger channel to pee through. So that when the bladder squeezes, there's less resistance to the outflow of urine and people have a better urine stream. One common question we get is, Well, hey doc, I picked this up at Costco and I was taking saw palmetto or some sort of nutraceutical treatment. And while that's fine, and a lot of people feel better taking a nutraceutical treatment, it's important to understand the evidence behind those things. So saw palmetto is the most common supplement, that's quote unquote recommended for an enlarged prostate. But in a randomized placebo-controlled trial that was published in JAMA over 10 years ago now, it showed that there was zero difference in urinary symptoms between saw palmetto and placebo. And in this graph here, I'm showing the placebo and saw palmetto, and you might not even be able to see the two lines there because they're exactly the same. In addition, there was no more improvement in other endpoints with saw palmetto versus placebo, but there were no side effects either. So my general advice is if you feel it's helping you, that's okay, but it's important to understand the evidence showing that versus a placebo or a sugar pill, really no difference. In contrast, we have multiple large, well-designed clinical trials showing that various medications are helpful in improving urinary symptoms and also decreasing what we call progression in BPH, getting to the point where you can't empty your bladder, you need surgery, or you need a catheter. And those are those medicines I mentioned before. They're what are called alpha blockers. And what those do is they relax that channel in the middle of the prostate. It's very analogous to us doing surgery on the prostate to open up that channel, but it just medically relaxes that channel. Those are called things like tamsulosin, alfuzosin, silodosin, doxazosin. Then there are medicines called 5-alpha reductase inhibitors. And those are medications like finasteride and dutasteride. You may notice finasteride because that's also a medicine that's used for hair loss in men. At a 1 milligram dose, finasteride is Propecia, or is used to reduce hair loss. But at the 5 milligram dose, we use it to shrink the prostate. What those medicines do is they stop the conversion of testosterone to what's called DHT, dihydrotestosterone, inside the prostate. Dihydrotestosterone is very important for prostate growth. So if we stop that conversion from DT to DHT, we can essentially shrink the prostate over time. But that takes a long time to work, really 6 to 12 months before you notice any benefit. And of course, all medicines have side effects. The alpha blockers can sometimes cause lightheadedness or dizziness. They can sometimes cause problems with ejaculation. So one problem that we talk about often is what's called retrograde ejaculation, meaning when you have an orgasm, less or no semen comes out. It's not a dangerous condition. And sometimes it's due to medications, like these medicines here, or it can be due to other things. In addition, the finasteride and dutasteride medications, as I mentioned, mess with testosterone a little bit. Therefore, they can be associated with other sexual side effects, low libido, low sex drive, erectile dysfunction, and sometimes even breast enlargement or tenderness. And so for these reasons, while we know these medicines are effective, a lot of guys stop them. This is a graph from California Medicaid data showing that only about 40% of guys actually continue these medicines over time. So in summary, we know that medicines like alpha blockers and 5-alpha reductase inhibitors work. They improve symptoms, improve flow rates, help you empty the bladder better, and decrease the need for surgery or catheters. But a lot of guys discontinued them due to side effects. So it's always important to talk to your doctor about side effects of medications when you're starting them. As I mentioned a little bit before, there are also a variety of surgical options for the prostate. And I could give an hour-long talk on each one of these, but in short, there are minimally invasive treatments like UroLift and Resume. UroLift, we put little clips in the prostate and basically kind of staple it out to the side. With Resume, looking with a catheter or a camera, and then inject steam treatments into the prostate. And that steam treatment kind of kills the prostate tissue so it sloughs off or falls off over time. The newest minimally invasive treatment is called iTind, which is a temporary device, kind of like a little spring that we put in the prostate that expands and stays there for about 5 days, and then we take it out. Those minimally invasive treatments can be either done in the office, under a little sedation, or of course under anesthesia if needed, but they usually only take 5 minutes or so. And the advantage is they almost never cause any sexual dysfunction, meaning that they don't cause problems with erections, and they don't cause problems with ejaculation, or usually don't. Then, moving on to the more traditional surgeries, the thing that's been around the longest is what's called TURP, or transurethral resection of the prostate. And I have that right here in the middle of the slide. For TURP, you generally go under what we call a general anesthesia. You're completely asleep, and your urologist looks in there with a camera, and then using a special instrument through the scope, scrapes out or cores out the middle of the prostate. That's been around, as I mentioned, for 30 years or more, and is often called the gold standard for treatment of prostate. Generally not associated with erectile dysfunction, but can cause ejaculatory dysfunction, meaning if you have an orgasm, less or no fluid comes out. Similarly, green light laser is essentially analogous to TURP. With green light laser, basically shaving down that prostate tissue with a laser instead of kind of scraping it out. That can be good for men who are on blood thinners or are particularly worried about bleeding complications. The kind of newer modalities are what's called HOLEP or THULEP, which is laser enucleation of the prostate. And that involves lasering down to the capsule of the prostate and then coring out the entire prostate. Kind of like if you kept an orange peel and cored out all the fruit in the middle and then kind of pushed it into the bladder. So the orange peel is still there, but all the tissue gets kind of pushed out. Then we morcellate it or chunk it up on the inside of the bladder to get all that tissue out. That's extremely effective at improving urinary symptoms because we remove so much tissue, but it can cause leakage in some men. General, maybe 15% of men over the first few months might have some leakage, and maybe 2% over the long term. But it's probably the most durable treatment over the long term. It does cause ejaculatory dysfunction as well, meaning that most men after a HOLEP won't have any semen come out. Again, not a dangerous condition, but one that's certainly important to understand and talk about with your urologist and or your partner. And then the other treatments that we do are robotics. The one robotic procedure that we do a lot of is what's called aquablation. And this is an image-guided procedure that uses a high-pressure water jet to kind of core out the whole middle of the prostate. This has been shown to be more effective than things like TURP or green light laser, and can preserve that ejaculatory function in most men. And then finally, there are really big prostates out there. The whales, the ones that are 300, 500 grams, those are probably best served by robotic surgery to kind of remove the prostate through incisions in your abdomen. That's a lot of information. How do you choose? Well, things that are important to know are how big is your prostate? How bothersome are your symptoms? Are you on blood thinners? Do I want to spend a night in the hospital? And how important is sexual function to me, ejaculatory function in particular? So these are conversations you should have with your urologist. And ultimately, all of these are just tools. They're tools that we use. And your urologist may be more familiar with one hammer than another, but if he does a good job with that hammer, take good care of you. But there are decision aids out there. So this is the Canadian Decision Aid, which is really helpful for patients, in my opinion. And we'll again have the link available for you. But you can go through and click a variety of different options and look at all these different factors. How will this improve my symptoms? What's the chance I need to have another surgery over 10 years? How will this impact my sexual function? And this can help you kind of talk through all those most important things with your urologist when you're making these decisions. So a quick example, this is a patient who is 61 years old, has a few medical conditions, has a lot of trouble getting the stream started. He's been on medicine, tamsulosin, which is one of the alpha blockers, but that's been causing some ejaculatory dysfunction, meaning when you have an orgasm, less fluid comes out. So that's been bothering him. He's got very severe symptoms as we measure them through our questionnaires that we have you fill out when you come to the office, and he's not emptying his bladder well. Bedside ultrasound shows he's got 225 milliliters left in his bladder. He did get an MRI of his prostate, and that showed a really big prostate, 216 milliliters. So in general, for prostates that big, the best options are things like aquablation, HOLEP, or simple prostatectomy. He was interested in preservation of ejaculatory function, so we did aquablation for him. This is a image of the prostate, and the bladder is off to the left of the screen, the kind of that dark space. But the computer outline here is showing the different zones of the prostate or areas that we're going to treat. The light blue line here is what we call the bladder neck. That's kind of the interface, the junction between the bladder and the prostate. And then back closer to where that yellow zone is where what we call verumontanum is, and that's where the ejaculatory ducts come into the prostate. So if we do a little tissue sparing around those ejaculatory ducts, most men can have normal ejaculation afterwards. And this is let's see if that video plays. Oh, looks like my video didn't transition over. That's a bummer. But you can just imagine this prostate tissue getting washed away by the high pressure water jet. And that's how we treat this large prostate. So kind of shifting gears a little bit, PSA is a screening test for prostate cancer that many of you may have heard of before. It stands for prostate specific antigen. It's a crucial tool in detecting prostate tissue issues early, and understanding what PSA is and how screening works can help you make an informed decision about your health. So PSA is a protein that's made by the prostate, and elevated PSA levels can indicate specific prostate issues, making screening an important part of preventative care for the prostate. Um, PSA screenings are essentially just a simple blood test. Most prostate cancer screening, starts around age 45 or 50, but can vary a lot depending on age and risk factors. So it's important to talk with your primary care physician or a urologist about, what's best for you. Um, there's no perfect cutoff of what a normal or not normal PSA is. It's kind of a continuous variable of risk, but often a PSA of 4, will prompt some evaluation. But it can also vary with age and with prostate volume. Because while PSA is most often associated with prostate cancer, PSA also goes up with prostate volume or size. So the bigger your prostate, the higher the PSA is going to be as well. And your urologist can do some adjustments so that we can see what the risk of prostate cancer is if we know your prostate volume as well. There's a calculation called density. Basically, take your PSA and divide by the volume of your prostate, and that can give us really good risk stratification to determine, what your risk of prostate cancer or high-grade prostate cancer is. Finally, there are some adjunctive tools that exist nowadays that are, in our practice common. Those are things like getting an MRI of the prostate in a man with an elevated PSA. And then there's some adjunctive biomarkers or blood work that we can get. Some of those tools are prostate health index, 4K score, or ISO-PSA. And those are essentially blood tests, but they give us a little bit better risk stratification than a PSA alone in determining if that PSA that's high is due to prostate cancer or if it's due to something like an enlarged prostate or inflammation. Prostate cancer is one of the most common cancers among men, and understanding risk factors, symptoms, and treatment options is really essential for early detection. As we mentioned before, the illustrious Dr. Brian Helfand will be on the pod next week, so I'm not going to steal his thunder, but I think it's important to just touch on prostate cancer a little bit. Approximately 1 in 8 men will be diagnosed with prostate cancer at some point in their lifetime, and prostate cancer is still the second leading cause of death among men. Age is the biggest risk factor, and prostate cancer is extremely rare in young men. So sometimes we have young men coming to the clinic really worried about prostate cancer. Unless there's a family history, it's extremely uncommon in men less than 40. In general, if your dad had prostate cancer, that's going to put you at higher risk. You should really get screened about 10 years before your dad was diagnosed. So if he was diagnosed at 55, you should probably have a PSA at 45. But that can vary, and other genetic factors can come into play as well. And if there's a family history of breast cancer, pancreatic cancer, ovarian cancer, or prostate, you may be at higher risk and may want to consider things like genetic testing. Symptoms of prostate cancer are uncommon in early stages. So if you're getting a normal PSA test, it's very uncommon to have symptoms directly related to that prostate cancer. However, in more advanced prostate cancer, if the PSA is 50 or 100, that can include things like difficulty urinating, blood in the urine, or other pelvic discomfort. It's one of the reasons why it's important to get a PSA test or screen for prostate cancer in concordance with your primary care doctor at an early age so you can catch it early. In general, there's a couple different treatment options for prostate cancer. And one thing that's changed a lot over the years is we try to do better risk stratification. Not all prostate cancer is the same, and there's a lot of low risk prostate cancer that probably doesn't present a threat to a lot of men's lives. In fact, there's a lot of academic or semantic debate about whether we should call some low-grade prostate cancer cancer at all, or if we should call it some other fancy name. At the end of the day, I don't know if it matters what you call it. What really matters is what you do with it. So, for example, if you have a Gleason 3+3 prostate cancer, the lowest grade of prostate cancer, the standard management now is what we call active surveillance, and that means monitoring. And that's because most men with low-grade prostate cancer won't spread outside the prostate, won't cause problems. But in general, about a third or so may progress to a more aggressive prostate cancer over time, which is why it's important to keep an eye on it. Once you have kind of an intermediate or higher grade prostate cancer, that's when we talk about more, interventions or treatments. And those generally include surgery or radiation. Surgery almost always is done robotically these days, meaning with the Da Vinci laparoscopic robot, where we remove the entire prostate gland and then sew the bladder back to the urethra. In general, that takes about 3 or 4 hours. You spend one night in the hospital and go home with a catheter. Catheter stays in for about a week. The other general option is radiation treatment. There's a couple different types of radiation, but in general, the principle is that we shoot high energy beams of radiation at the prostate to kill the prostate cancer cells. For more advanced prostate cancer, sometimes we also use hormonal treatment. And as I mentioned before, testosterone and DHT are really important for prostate growth. So what we can do is if we shut off that testosterone or kind of starve that prostate cancer, we can often give it kind of a 1-2 punch with radiation and with hormone treatment. And we generally preserve that for higher grade prostate cancer or advanced prostate cancer. But there's a lot of kind of nuance and different, very important things here to talk about with the urologist, but hopefully that's a broad overview that can help. Now, shifting over to prostate health. Prostate health can be supported through lifestyle changes and regular checkups, and being proactive can certainly help reduce the risk of developing bothersome issues. Healthy lifestyle changes, such as regular exercise and avoiding smoking, can significantly benefit prostate health. And so in that way, prevention is key. A balanced diet of fruits, vegetables, and healthy fats, along with regular physical activity, supports prostate health and overall well-being. And there's even some evidence that a plant-based protein may be linked to improved functional outcomes in men with prostate cancer. However, I think it's really tricky to interpret these type of data because men who, generally eat only plant-based protein may also have generally healthier lifestyles. So, my general advice is you want to hit the basics, right? You want to get exercise, you want to eat right, you want to get good sleep, you want to be involved in your community and avoid too much stress, anxiety, and that sort of thing. This is a study we did using the UK Biobank, which is about 500,000 people who have all kinds of information about them, genetic information, and basically all the types of diagnoses that they've ever run into in their lives. And what we showed is that people who are more physically active, they have higher levels of physical activity, have a lower risk of diagnosis of BPH. And this persists even if we take their genetic risk of BPH and then just adjust it for how much activity they're getting. So men who have 3 or more days of vigorous intensity activity, 20 minutes a day, 3 times a week, have a lower risk of getting diagnosed with BPH or bothersome urinary symptoms compared with men who are sedentary. And so in my opinion, this really supports that at least moderate physical activity, should be encouraged as part of men's health. So hit the Peloton, hit the gym, get out there and walk, whatever you can do. It's one of the most important things you can do for all aspects of your health. And finally, as I mentioned before, all this is critical to work with your primary care physician, and or your urologist. You want to make sure you're getting regular checkups, monitoring of prostate health through appropriate screenings, and those can help, identify potential issues and ultimately promote better outcomes for you. So finally, understanding and maintaining prostate health is crucial for every man. And through awareness, lifestyle choices, and regular screenings, men can take proactive steps toward a healthier future. Thanks for having me on the pod. Happy to answer any questions. I've got my email, my Twitter, my office phone here, and we'll provide some of those links that I mentioned in the discussion and in the chat later. So thanks again for having me.
Wow, thanks. So much good information. Wow, just a lot of things to unpack and a lot of good information, but I love all the tips and all the pointers. I was thinking a bit about a couple things. One is that size, and this is something that patients come all the time, and they're really concerned about. They have this really large prostate. It's been checked and they've been told that. But like you said, the thing is how much it grows out doesn't make a big difference in urinary symptoms. What matters is the urethra goes right through the middle of it, and how much it squeezes in on that urethra. That's where it really starts causing problems. So like you said, you can have this big prostate that's not causing problems and a small one that's squeezing in a lot on that urethra, and they're really struggling, right?
Absolutely. Yeah, it's one of the kind of things that I find as a scientist the most fascinating about why certain prostates cause problems for men and some don't. And it may have to do with the different types of cells inside the prostate and how they grow and how that resistance changes over time. But it's one of the many factors we need to keep in mind when we're evaluating a man for urinary symptoms. How big is the prostate? How bothered are they? And what other things could be contributing to urinary symptoms?
Yeah, and then too, that'll help our listeners really understand. So, the most popular treatment out there, and we didn't have it before. I mean, years ago, you came in and if you lived long enough, you were going to get a TERP. That's pretty much how it went, right? Now we have these alpha blockers, and probably if you live long enough, you're on an alpha blocker or you're going to go on an alpha blocker at some point. And again, they're not going to shrink your prostate. The alpha blockers, you're still going to have that large prostate, but it's going to relax that prostate away from the urethra. So I think it's really important for our listeners to understand that concept of how squeezing the urethra causes problems at the bladder neck. And I think what's also important is that it causes those two types of symptoms, those irritative symptoms. Oh, now I got to get up at night. Now I got to, and I'm peeing more often, and I have to go more urgently. When I got to go, I really got to go.
Mm-hmm.
And then those obstructive symptoms where it's like, wow, my flow is not what it used to be. It doesn't feel like I empty completely. Different things like that can occur. And I think that's really about how it squeezes in on that urethra, which goes right through the middle of it. So I think it's interesting stuff. And then too, with the medications and the treatments, you talked quite a bit about the ejaculatory disorders, and I want to make sure the listeners really understand. So, because if you live long enough, right, you're not going to propel like you used to. You're not going to have the volume you used to. I mean, every decade, that kind of guys, it just kind of is going to diminish over time because people come in all the time. They're like, wow, it's like that just seems like it's gotten less and less to where sometimes it almost feels like it's non-existent, especially if they're on treatments for their prostate or have problems with their prostate. So it's a normal part of aging that you will not propel and have the volume in your ejaculate as you get older anyway. And then some of the treatments, like the most popular alpha blockers, may cause that retrograde ejaculation where you don't ejaculate out. It sort of comes out when you urinate later, right?
Mm-hmm. Yep. Yeah, and very good point. Time makes fools of us all. It's one, and there's no stopping that, and that could certainly be a factor as well. But it's just important to recognize that there's more treatment options than ever, and it's important to recognize all the different things that are out there, and make an individual choice, based on what's important to you.
Definitely. And so, and some people with those treatments too, with the lack of ejaculate. I mean, we've all had different patients, and I've had patients. One of the partners said, "It's great. There's no mess. There's nothing," and they were like, I was like, well, that's looking on the bright side, definitely. And some people are really troubled by a lack of ejaculate and fluid not coming out. So I think knowing the patient is monumentally important, and knowing yourself. And is that a big deal to you? If you're not trying to procreate, do you care how much volume or fluid comes out, or if none comes out? That is something to know and understand as you're looking at and trying to stratify what treatment is right for you. So I think those are some really good points that you brought out that I really appreciated a lot.
Well, Jeff, that brings up a very good point as well. Some people, there's some data showing that some people overestimate how much they think their partner, cares about that function, that ejaculatory function. And so it's important to, involve your partner in these discussions as well, if it's something that, you're making a decision together about.
And even for them to understand, because they're like, oh,
Yeah.
what happened? Suddenly there's not ejaculate, you know what I
Yeah.
mean? And
Yeah.
it's like erections too. People are like, well, I always knew he was excited when he got hard, but he's not getting hard. He's still really excited. So when those things change, I think all these things, including the partner in on these discussions and these visits, is I always try to encourage people to bring partners. So that's a really great point. Definitely.
Yeah. Being open and mindful with your partner, I think is, one of the things that you've always stressed in the clinic. And I think it's just such great advice.
Yeah, for sure. And then, but I have had funny stories. Some patients say, "What? It's like it's changed so much. Everything changes when we age. It's so crazy. So many crazy things happen. Aging is a challenging thing in so many ways." But one guy was like, "It's like I used to be able to write my name in the snow when I urinated." I'm like, "Okay." He's like, "I can't do that anymore because I got this weak stream." But so I think a lot of really good points were brought up, and I think you hit all the highlights. So there's two questions that came up. Question one was, I do notice I go to the bathroom more often and more urgently, and my primary care is aware of the problem. At what point do I need treatment, and should I wait sooner, later? Will that matter so much? I thought that was a pretty good question.
It's a really good question, and one that I wish we really had a more definitive answer to. Um, in the current answer is essentially when it gets to the point that it's bothering you, that you're willing to, try medicine to take once a day, or to go see a urologist to go talk about, some of the different, treatment options, whether that's a minimally invasive treatment because they don't want to take a pill every day, or if you want to go full bore and have a prostate surgery. A lot of it, as long as you're not, as long as you're emptying your bladder and you're not having, recurrent infections or bladder stones or some, more complicated thing, a lot of it comes down to quality of life. And that's why it's so
Mhm.
important that I think we measure quality of life or bother, how much does it bother you? Does it bother you enough that you want to take a pill or do a procedure? And as long as you're not having any of the more serious things, I think that's what it comes down to. There is more interesting kind of scientific question is it better to intervene sooner rather than later? And we don't have a great answer to that. My answer is it's probably better, but it's hard for us to prove. Meaning that if you're having trouble emptying your bladder, if we can decrease the resistance that your bladder has to push through, you'll probably preserve your bladder health, your detrusor function over time, compared with somebody whose bladder is pushing hard and hard and hard for 20 or 30 years and then shows up at the urologist. Because occasionally we see somebody who shows up, they didn't even really notice that they were having a problem, but their bladder's been pushing so hard for years that it doesn't have good squeeze anymore. And
Mhm.
that's something we want to avoid. So, if you're having bothersome symptoms, certainly important to get evaluated.
I think you bring up such a good point. It's patient centered and it's based on your bother. But when it's really important is if you're having those obstructive symptoms where you feel like you don't empty completely. And like you said, sometimes you don't even know. I had a really good friend in his 60s, and he just went for his routine, regular yearly exam, and his kidney function was off. Ended up, guess what happened? You can imagine. They figured out he was not emptying his bladder, and you know what this like. You've seen it in the office, just like I have. How many liters do you think were in his bladder when they did his ultrasound? About
Oh yeah.
two. About 2 liters. He literally 2 liters of fluid were in his bladder, because the bottom line is sometimes it happens gradually over time and you don't necessarily notice it. But if you are emptying incompletely, or you feel like you're emptying incompletely, that's those obstructive symptoms. I think you're right. That's where you need intervention sooner rather than later to preserve bladder function and upper tract kidney function. Even more important, you don't want that fluid. It's got to go somewhere, and we don't want it to back up to those kidneys and stuff like that. So great point though, at when to do it. Definitely. I have a second question for you that came in early, so I think you somewhat answered it, but I just wanted to see if you wanted to summarize any further about this answer that you really gave, because this came in before the slide on that. What lifestyle changes or preventative measures can I take to support long-term prostate health? And you did a beautiful job of covering this, but anything you want to hone in on for that?
Sure. Yeah, there are a variety of studies out there showing that various diets, might be good for, overall long-term prostate health. And a lot of those seem to correlate with, generally having good metabolic health, good cardiovascular health. So I think the specific details of eating this or that probably, in my opinion, doesn't matter that much, but you
Mhm.
have to eat healthy, meaning,
Mm,
should be mostly vegetables, fruit, some protein, but that's not the whole thing. It's the whole picture of, overall men's health. And that's the basics, the things that are the hardest, right? Those
mm,
are exercising 3 times
mm.
a week or more, getting good sleep. Something I struggle with a lot is getting that 6 to 8 hours of sleep, on a regular basis so that you're well rested, that your circadian clock is correct. And that sets a lot of other things in terms of tone for metabolic health as well. And then avoiding too much stress, staying involved in your community, with your partner, with your friends, something that's often overlooked in a lot of Western medicine, but is absolutely critical and hopefully something we're paying a little bit more attention to these days. Um, and so all of those things combined, in general, lead up to, what can I do to be, to support men's health in general? And all
Mm.
those things are going to support prostate health, urinary symptoms, and those types of things as well. So, eat right, exercise, get good sleep, all the stuff your grandparents said is probably the right thing to do, right?
It's so true. Men's health equates to both sexual and prostate health. That's the bottom line. You hit on it perfectly. And next month, June, is Men's Health Month. So get healthy. Diet, exercise, sleep. Try to avoid things like drugs, alcohol, caffeine that aren't always the greatest thing. But just like you said, like your mom told you, or your grandma told you, or whoever told you, that healthy living is essential to, especially as we age and all these things. If you live long enough, don't you agree you're going to have probably issues with your prostate impinging and causing these urinary symptoms?
Absolutely. If you look at the prevalence, or how many men in their 80s or 90s are dealing with this, it's basically 80 or 90%. And so, the better you can prepare your body to enter into that later phase of life, by starting sooner, coming into those later ages with better physical fitness, better metabolic health, the better you're going to do at that stage as well. And so that's why it's important to just do this throughout your entire life, even though it's hard. All of us are busy, but I still think those are some of the most important things you can do.
Definitely. And I like that you brought up the stress thing, but I was going to ask you, how's that going for you with the stress thing? Because I know you're probably pretty stressed these days.
Oh, you just got to balance it, right? I mean, you
Got to
might have heard
balance
my
it.
daughter screaming in the background. It's bath time,
It's all,
and
yeah,
that's life, right?
it's all good.
It's
Excellent.
life.
We have unpacked some great things. I'm going to go to a centering exercise that we're going to do, and then we're going to find out what's up next week and finish out. All right. So, gosh, lots of really, really good information. Excellent, excellent presentation. All right. Take a moment, find a comfortable position. We've given you a lot to digest. Find a comfortable position. Close your eyes if you want to or feel comfortable. Take a deep breath in. Breathing so powerful. Fill your lungs fully. And then slowly exhale, letting go of any tension that you might be holding in your body. Continue that breathing pattern. With your next inhale, imagine a sense of calm spreading. We talked about stress. Imagine that calm spreading through your body. As you exhale, release any worries, any concerns you may be holding, any tension. Where do you hold it? Your jaw, your neck, your shoulders, your back, your pelvic floor, your thighs, your calves. Let it go. Deep breaths in. Slow exhale out, releasing any tension, letting go of all the worries. Release any of those worries that you might be holding or any concerns. Silently repeat the following. I take charge of my health and awareness and care. I take charge of my health and awareness and care. I support my body with choices that nurture and heal. I support my body with choices that nurture and heal. When you're ready, gently open your eyes, feeling more grounded and centered, and carry this sense of calm. Remember that calm. Carry this sense of calm with you throughout your day. We are so glad that you joined us, and I am so grateful to my guest, Dr. Alex Glaser. It has been a wonderful episode, and we thank all of you for your time and attention, and hope that you have a wonderful rest of your day or evening or whatever time of day it is that you're watching this. And thank you so much for joining. I hope it's all been informative. Have a great one.
In this powerful episode, Dr. Jeff is joined by renowned prostate cancer surgeon and researcher Dr. Brian Helfand for an in-depth conversation about prostate cancer, the most common non-skin cancer among men. Dr. Helfand shares his expert insight on risk factors, early detection, genetic testing, and the latest advancements in treatment. Whether you or someone you love is navigating prostate cancer or simply seeking to be proactive about your health, this episode offers clarity, hope, and practical knowledge from one of the leading voices in the field. Join us May 20th at 7 p.m. Central Time to learn more.
That's why it's so great to have Vic behind the scenes, because he remembers when I forget what's coming up next week, Dr. Helfand, which you've already heard from Dr. Glaser as well. But thank you so much, Alex. It's always a pleasure. He is a phenomenal urologist. I've worked with him in clinic, and I really appreciate all you do and sharing your expertise. Thank you, and taking time away from your kids. So thank you so much.
It's great to be here, Jeff, and to talk to your audience like this. As we were talking before, this is the future of how a lot of information is going to be shared. We're happy to be here, happy to share that knowledge, answer questions. We're here for our patients.
Definitely.
Thanks for having me on.
Definitely. Well, thank you, audience. We really appreciate you. It's been an informative episode, and we wish you the best.